Hi and welcome back to my channel. As you can tell by the title, I'm going to talk about the Canadian healthcare system and from my perspective, if it's really as bad as people say or if it's really good. And by the end of the video, you'll kind of have an idea of how I feel about it personally. So I'm going to try and do this as quickly and concisely as possible. So let's just get right into it. So if you don't know, I am Jamaican and I moved to Canada 4 years ago. Almost exactly 4 years ago, coming up next week. And before that, I also lived in Japan for 4 years. So I have the perspective of 3 different countries and their various healthcare systems and how they compare. So let me begin. So from Jamaica, your healthcare system depends on how much money you have and if you can afford private insurance. So when I lived in Jamaica, I paid for private insurance, big up Sagicor, for the whole time that I was working as an adult there. In Jamaica, I would pay about 60 Canadian dollars every month for private insurance, and that would cover like 80% of almost everything. So dental and optics ophthalmologist. So as you can see, I wear glasses. I had to go to the ophthalmologist every single year, so that was covered. If I went to the dentist, 80% was covered. Medicine, hospital visits, 80% was covered. It was a really good health insurance plan that I only had to pay 60 Canadian dollars a month for. And yes, the Jamaican healthcare system, it's not as great as, say, a developed country like Canada or a developed country like Japan, but it wasn't that bad because I know I had 2 medical emergencies. One when I actually lived in Jamaica and I had to run to Andrews in the middle of the night, and I had insurance then, so insurance there then at that time, so it was covered. And another time when I was living in Jamaica between when I came to Canada, so I didn't have any health insurance and I only had to pay about $6,000 when I ran down to St. Andrews again, which is a private hospital. So it honestly depends on your economic background, the type of healthcare you can get in Jamaica. So keeping that in mind, I'm now going to go on and describe a little the Japanese healthcare system. And if you've watched my videos, you know that I did do surgery in Japan and that experience. And if you've ever lived in Japan, if you know anyone who lived in Japan, you know that there is a healthcare system where every single citizen must pay and must contribute to the healthcare fund. Everyone living in Japan, registered to live in Japan, must pay this, and it was about 140 Canadian dollars every single month, which I was happy to pay because honestly the healthcare system in Japan is amazing. And I managed living there and going there, like for example, I fainted one summer. I would have fainting spells because it was so hot, and going to the city health center was a breeze. I didn't have to pay that much after paying the 140 Canadian dollars every month, so it was heavily subsidized. Now in Canada, we have like a universal healthcare system where everything is technically free, and honestly I reap the benefits of that with all the medical procedures I've had to do. But you pay through it indirectly from your taxes. So we're heavily taxed in Canada. I was heavily taxed in Japan also. And what I liked about that is you saw where the tax money was going. In Jamaica, however, you did not see where the tax money was going really, because it wasn't going where it was supposed to go. But that's a different story at a different time. Let's focus on positives. Like I said, in Canada, they tax you through the woo-ha. Same thing for Japan, but you see where the money is going. So I will never have a problem with paying high taxes, knowing that it's going to go where it's supposed to go. It's going to go back into healthcare. It's going to go back into education. It's going to go back into parks and recreation. So we pay a lot of money in taxes, but I don't have to pay anything else for medical treatments. Dental and optical, that's the word, optical. Dental and optical, however, not covered. Well, that's a lie. They actually introduced dental care for children of low income families. That was literally introduced last year, late 2023. And before that, I know for optical, if you're between under the age of 18, your optical needs are covered, and if you're over the age of, I think, 65, it's covered. But everybody else, them get what a duck get, if you know what I mean. So it's very important that you have additional health coverage from your job to cover those expenses. Otherwise, it's going to be very expensive. For example, before I had the current job I had and had the medical plan I have with them, I was paying for private health insurance using Blue Cross, and it was like it was $90 every month, but it still didn't cover that much of my dental expenses. I was still paying like $100 every time I went to the dentist to clean my teeth. So yeah, dental and optical for adults, not so much covered in Canada, but everything else very covered. So now I'm just going to go through how the system kind of works here in Canada. If you want a specialist, no, you have to backtrack. The most important thing for you to do is have a family doctor. If you don't have a family doctor, it's very difficult. And I just want to preface this by saying I live in Toronto, which is a densely populated city in Canada, the largest populated city here. So I have a lot of opportunities that persons in other parts of Canada do not have, and I'm very privileged with that. So when I landed in January 2020, right before COVID, I went through the process that you're supposed to go. You're supposed to land, you're supposed to get your health card. As soon as I got my health card, I was registered and had my SIN number. I went on ontario.ca, and then if you Google it, how to find a family doctor, it'll take you to Ontario CA, and then it will take you to, let me just double check this, Healthcare Connect. And from Healthcare Connect, you register to try and find a family doctor. And what they'll do is they'll take your information and they'll send you options near to you. And then you choose from those options. So I got a letter in the mail and they said, this is a doctor available. They're taking on patients. If you want the doctor, let us know. And I selected preferences. For me, I didn't want a male doctor. I'm big up to the male doctors out there. I just don't want you as my medical practitioner. Sorry, not sorry. So yeah, so my only preference was that it was a female or a woman family doctor, and they sent me an option. I got her, and this was around March, February, and then by when did I get her? By June 2020, I had an appointment with my family doctor. We had an interview. Since it was COVID, we couldn't meet in person, but we had a video conversation. I told her all my history and any concerns I had, and that was it. From then on, I was registered with my family doctor, and she's been my family doctor for the past 4 years. I absolutely adore her. I don't ever want to lose her as my family doctor, so fingers crossed she continues practicing for as long as possible. So since then, any little problems I have, I call my family doctor. I make appointments if it's major concerns, or if it's not major concerns, then she'll send me just the requisition form to then go and do, for example, x-rays. So if you have a referral from your family doctor and you take that to the x-ray department, then it's covered. You just walk in, show your referral, show your health card, done. Nothing else. You don't have to pay anything. So for example, I smashed the back of my heel on my shower getting out. I called my family doctor, told her what happened. I got a referral for an x-ray in an email here, got it done. They send the results to her, and then she tells me if I broke my ankle, which I didn't. So that's basically how it's done. So it's very important that you have a family doctor, and the problem is that a lot of people are having such issues with the Canadian healthcare system is that getting a family doctor is so difficult because there are not that many around. A lot of the family doctors are retiring. They don't want to do it anymore, or COVID just really took a lot of them out, and many new medical students are not interested in the family doctor field. So that's the problem that a lot of persons outside of Toronto, outside of the big cities are having. They're not finding family doctors in their area that are taking on new patients. So the waiting time for them is very long. But as you saw, it only took me about 4 months to get my family doctor. That was in 2020. I don't know if it's changed since then, but like I said, I'm talking based on my experience. So one of the things I wanted to do was, as soon as I got to Canada, was to also get a gynecologist, because I'm a woman, I have a history of fibroids. That was important to me. So I spoke to my family doctor, and then to get a specialist, which a gynecologist would be, a gastroenterologist, an ENT, any specialist. To get a referral, you have to go through your family doctor. Again, why it's so important to have a family doctor. I spoke to my doctor, and she referred to one of her colleagues, or who she normally refers her clients to, and then I had to wait about 4 months to get an appointment. Was it 4 months, or like about 3 months, 2 months, to get that appointment with the gynecologist? But I needed a referral from my family doctor, and so that way was cool. The only problem with the gynecologist, if you don't go to her for 2 years, you have to go back to your family doctor to send a new referral, which is what happened to me in 2022 when my fibroids started. They came back with a vengeance, and so I needed medical treatment again. So I had to go back to my family doctor, go get a referral for the same gynecologist that I had before, right? And then go back to her. And then that gynecologist couldn't do the surgery that I needed. So she then gave me a referral. Like that timeline, like I have that timeline. So I went to my family doctor in January. No, my family doctor got me an appointment for January 26th of 2023 to the first gynecologist. And that gynecologist got me another referral appointment for May 31st, 2023. And then that gynecologist, the new one, the surgeon, she said, just wait a couple months until we have a time set, and then we can do the surgery. And that didn't happen until August 24. So it took 8 months for me to have this procedure done. But again, it's free. I walked into the hospital. I walked out of the hospital. I didn't have to pay nothing. Nothing. When I was in Japan and I did a similar procedure, because I was paying into the healthcare program there, they paid for 80% of what I did, of the cost. So my 2 million yen operation, I only had to pay $2,000. Was it 2,000 or 200? $200,000 from that. So, and that's about 2,000 Canadian dollars, or like 1,500 Canadian dollars. In Jamaica, I think it would have been cost me about the same as it cost in Japan if I had the same private insurance I had with Sagicor. So again, Canada's winning with that. It's just the time period was long. But you see that timeline, that's what a lot of people complain about. But I wasn't dying. It wasn't an emergency. It was just something to improve my quality of life, which was really being impacted. And it all worked out in the end. It was free. The surgery was successful. Follow-up appointments weren't, I didn't have to wait too long for follow-up appointments. So it was really, I appreciated that. So I have no problem with that. And then other specialists that I have used through the Canadian healthcare program is my gastroenterologist. My gastroenterologist. So I've always had, like, not gastro problems, gastrological problems, along with the gynecological problems. Fun times for my body. So in 2021, I went to my family doctor. I told her my problems, and she didn't even need a referral to the doctor first. She just immediately referred me to have a colonoscopy. So I had a colonoscopy in 2021. I think the timeline for that was, I got the referral, I got the appointment letter for the surgery in June, and I had to wait 2 months for it in August. So that wasn't really a long wait. And again, I showed up to the hospital, I did the surgery, walked out, did not have to pay anything. So it was free. I did not pay a red cent. So again, big up to the Canadian healthcare system for that. And the surgery was successful. I had the follow-up appointment with the specialist, the gastroenterologist, afterwards, and everything was fine. So the only problem I have there is, this is real time now. This is real time. I have a second video I'm going to make about the emergency care system, which technically isn't that bad, but it needs a whole video for itself. And I'll go into more details there. But from my experience going to the emergency room just a few months ago, like almost 1 month ago. I have been waiting for an appointment with my gastroenterologist since then. So the issue that I have been having since the second week in December, it is now January 13, and I'm still waiting. I'm still waiting for this issue to be cleared up through an appointment with the doctor to get some meds. That hasn't happened yet, but patience is a virtue. It's not too urgent. It would improve my quality of life, but it's not urgent because I went to the emergency room and they said it wasn't urgent. So, and then the Christmas holiday season, so you know how that go. But I'm still waiting. I am still waiting. Hi, so I got a little update since recording the video you're watching now, and it's that I got the appointment to see my gastroenterologist on March 19, but since that's like almost a month and a half from now, or almost 2.5 months from now, I called my family doctor, asked her if there was any medicine she could give me in the meantime to kind of help with the problem I'm having. And she's so sweet, she's so wonderful. Of course, she went and got the old prescription I got because, like I said, this is something that happened 2 years ago. So I got the prescription for the medication I took in the past, and I'm gonna use that to try and treat it until I can see the specialist. And here are the 4 boxes of the medicine that I have to take. And honestly, it's a lot. It costs $312, but because I have insurance with my company, I only had to pay $67. And if I didn't have that insurance, there's a program that I could have signed up with to reduce the cost of my prescriptions. It's called the Trillium drug program, and I actually signed up with that 2 years ago when I had the same issue, but I did not have insurance through my company, and they helped me to subsidize the payment of that. So that's an option for lower income families or families that don't have health insurance copay. So yeah, otherwise I would have had to pay $312 out of pocket, but I only had to pay $65 because I do have health insurance. So that's the update. Like I said, this is why I'm so happy with the health program here. You know, I call and I can get the medication I need. Now back to continuing the video that I previously recorded. So hopefully I get that referral letter, because when you go to the emergency room, they send the report to your family doctor, and from there the family doctor sends a referral to whoever needs to get that information. But yeah, so I like the healthcare system in Canada. I appreciate the fact that it is free. It's free. You pay taxes for it, but yeah, it's free. You don't have to pay nothing else after that. If I have a child, it will be free. If the child has to go into the ICU for 17 months, I think it's free. Cancer treatment here is free. Most of it is free. I think the treatment is free, but you have to cover some of your medical expenses, medicine, I think, but most of it is free. The only problem is that a lot of people have a issue with is that the wait time. Most people want things instant, but I think if people had an appreciation of how long other people have to wait in countries and then spend a bag of money, like these crazy Canadians are coming on the internet and talking about how the American healthcare system is better because they just pay and go. Yeah, but if you have an emergency if you have an emergency case and you don't have health insurance, you're dead. Honestly, again, I come from a place of privilege. I live in Toronto. Things are much easier in the big city. That's why I moved here. But yeah, if I mash up my foot, I call my doctor. I get a referral, X-ray free. I had a lump in my neck. I went to my doctor. She touched it. She felt it too. We did an X-ray. Free. It was nothing. So I really like and appreciate the healthcare system in Canada. If you want to have a discussion in my comments, talk about your experience, just include where you're from, if you've ever lived outside of the country, if you understand what other people go through in other countries with healthcare system. And I think an understand that kind of comparison will make people realize, boy, it's not that bad. It's not that bad. Anyways, that's it for now. Part 1 of my the Canadian medical healthcare system video. The second one about emergency room care, that one is a doozy. I'll come back with that after. So, till next time. Bye.